This particular article, Preservation of Person-Specific Knowledge in Semantic Memory Disorder, a longitudinal investigation in two cases of dementia, is basically an article about dementia. They used two patients called PK and PR. PR was a retired salesman, whereas PK was a retired civil engineer. Both of these patients was observed over a 6-year span, and one of them was observed in a 2-year span. And in that period of time, they gained knowledge and access of the domains that they were observed in. The sessions were brief due basically to the clients becoming fatigued or something like that. So they pretty much did like a 30 to 45 minute increments when it came down to the assessments and the tests. Pretty much the patients were given a test called a PPT test, the written word picture matching test, and other different, they match faces and objects together. And there were also some substitutes for some of the tests given due to some of them that were given were too complicated and too complex for the clients. There was different versions of the test given to the patients because sometimes they would get fatigued, so they would have to make everything a little bit brief. There was also an assessment that was given, and that was given over a 3-month period within 35 to 45 minute increments as well. And there was no specific order in which the test was given in. And in general, again, once they did the assessments, they pretty much made sure that the domains they got the knowledge that they needed to give a clear diagnosis. But it's my belief, that they gave too many tests. They gave too many assessments to try to come up with a clear answer to what they were looking for, what they were trying to do. In my job, we give assessments, but they're every 6 months to a year to basically see the progression, to see whether or not the supervision that we're giving the person is if it's working or not. And you can tell, within that 6-month time span, if there's something else that needs to be done or a little less of something that needs to be done. But for both PK and PR, after the assessments and the tests were given, they realized that both of them had a rapid decline in the general semantic area, which basically is in the language area. So when it came down to the other testing, the word picture testing, the matching, and the performance on the knowledge test, they were both in the normal limits of what they were expected. So, but I feel like, once again, like the assessment should be given, and then once you assess the situation after giving the test, then you'll know basically the supervision level, or know if you need to give more tests. You don't want to stop in the middle of a test and say, oh, because it's complicated, we're going to stop and give them another test. No, you give them one test that fits for everyone, if that's even possible, and then you go from there.